As we are wrapping up Heart Month, we're focusing on our heart health. So with us today is Cone Health Cardiologist, Dr. Christopher Schumann with the Cone Health Heart Care at Northline Avenue. Let me get that out. All right, so let me give you an easy one because you're going to be able to speak a whole lot better than I am this afternoon. All right, let's talk about the biggest misconception that people have about heart health that you'd like to set the record straight about.
Well, hi, Tanya. Thank you for having me on today. There's quite a few misconceptions that I often hear about heart disease. One common one is patients saying, I'm too young to have heart disease. That's something that affects older patients. And while it's true that heart disease is very prevalent as we get older, every day in clinic I see middle-aged adults and even young adults who have heart disease. So it's really something that can affect people of all ages and something we all need to be aware about.
Okay, yeah, because I think a lot of people, you're right, think that heart problems only affect the older adults. So is there then a certain age that we should start paying attention to our heart health?
So I would say right now, it really doesn't matter how young you are. You're never too young to start developing those lifestyle habits that are going to lead to a healthy heart both now and for decades. And I also think it's very important, even for young adults to be aware of those risk factors that can lead to the development of heart disease. And there's kind of 5 major risk factors that we always think about that can lead to heart disease. Number 1 is smoking cigarettes. Number 2 is high cholesterol. Number 3 is high blood pressure. Number 4 is diabetes. And number 5 is a family history of heart disease. Those are all things that can lead to the development of heart disease. And so important for, even as young adults to be aware of those things.
Okay, so with that said, I want to talk about like maybe the top 3 steps people should start making today to support their healthier heart. And since I heard you talk about smoking, I'm guessing you're going to say one of the first things is stop smoking.
Yes, absolutely. Smoking is definitely one of the biggest things we see that contributes to the development of heart disease. And so that's, absolutely imperative is quitting smoking. Other things I would say, number 1, exercise. Getting regular exercise is so important. We always advocate getting a minimum of 30 minutes of exercise 5 days a week. And, it's not that you need to be running or swimming laps for 30 minutes, but just getting a brisk 30-minute walk in 5 days a week is the goal for exercise. Then another thing I would say is diet. Diet is so important. And we advocate a heart healthy diet that involves avoiding the red meats, the processed meats, limiting salt and sugar and alcohol intake, and then a diet that's rich in fruits and vegetables and whole grains, and the good proteins like nuts and fish. So diet is also super important. And the last thing I would say is just having a good follow-up with your doctor. So establishing care with either your primary care doctor or your cardiologist, and following up regularly and being screened for those risk factors we talked about that can lead to heart disease. So, having your blood pressure checked, screening for high cholesterol, screening for diabetes, those things are so important.
Yeah, and we've talked to other doctors before about how blood pressure and stuff like that, a lot of times you don't know you have high blood pressure because you don't think you feel bad.
Absolutely. You can be totally asymptomatic and think, and I think a lot of people fall into that trap of thinking they don't need to follow up with a doctor because they feel fine. But often those things like high blood pressure, high cholesterol, diabetes, you may have no symptoms with, and that's why it's important to get checked out.
Okay, well, let's take this angle part of it. What about the people who have that family of heart disease? They have that history there. What additional measures should they be taking?
Yeah, so if you have a family history of heart disease, the first step I would say, let your doctor know about it. So if you have either a parent or a sibling who's had a heart attack, had a stent put in their heart arteries, or had bypass surgery for their heart, let your doctor know, because that could mean you're at increased risk of developing heart disease yourself. And a common test that we do, especially in patients who have that strong family history of heart disease, is something called a calcium score. It's a CAT scan of the heart, doesn't involve any contrast dye. We're actually able to quantify the amount of calcified plaque in the heart arteries. And that can help guide us in terms of how aggressive to be in terms of managing those risk factors for heart disease, in determining who would benefit from being on medications like aspirin or statin to decrease the risk of having a heart attack.
And is that something that only like a cardiologist would order, or is that a primary care doctor kind of thing?
Yeah, so that can be ordered by both. So both primary care doctor or a cardiologist can order that calcium score heart scan.
Right, and I ask that because I think people want to know, like, how far in do I have to get before I get that kind of test that I think that I might need or that I'm interested in?
Yeah, absolutely. Can be definitely ordered by the primary care doctor. Now, if they see a lot of plaque in your heart artery, they most likely will refer you to a cardiologist, but absolutely can be ordered by the primary care physician.
Okay, and we know that heart disease disproportionately affects African Americans. Let's talk about that and what kind of steps should be taken to reduce risk.
Yeah, that it is true. African Americans are about 30% more likely to die of heart disease than white Americans, and they're about 40% more likely to have high blood pressure and 60% more likely to have diabetes. And they're more likely to develop heart disease at a younger age. So I think it's, the most important step I think is establishing care with a doctor and getting regular follow-up to look for those risk factors, to have the blood pressure checked, to screen for diabetes. So if any of those risk factors develop, they can be started on medications early to prevent progression to heart disease.
So what kind of signs should we be on the lookout for that would indicate that it's time to check in with your provider?
Yeah, so symptoms of a blockage in a heart artery, classically present with chest pain when you exert yourself, or when you're under emotional stress, feeling discomfort in the chest. But for some patients, it presents more as shortness of breath. But in either case, chest pain or shortness of breath when you're exerting yourself, definitely a reason to be evaluated. Symptoms of a weak heart muscle or heart failure, those could be also shortness of breath when you exert yourself, or shortness of breath when you're trying to lie down to sleep at night. It could also be just feeling really fatigued all the time, or lightheaded, or having swelling in your legs. Those are all reasons to be evaluated.
Okay.
And then a final symptom that we often get referrals for is heart palpitations, or feeling like your heart's fluttering or racing. That could be a sign of an abnormal heart rhythm, and important to be evaluated.
Gotcha. Okay. Some people believe that if you look healthy on the outside, right? Maybe you do run a lot or do you exercise, then you must have a healthy heart. Let's talk about some silent signs or risk factors that people should know about.
Yeah, as that plaque forms in your heart arteries, it typically doesn't cause symptoms till it's causing about a 70% blockage of the artery. So there could be a lot of plaque in the heart arteries, and you could be totally asymptomatic. And so that's why it's helpful, those tests like that calcium score we talked about, where we actually are able to see how much plaque is in the heart artery to try to get patients on the medications to prevent that plaque from growing and decrease their risk of having a heart attack.
Okay. So warning signs. I think that people are always kind of, and you alluded to them just a little bit, but let's talk about them a little bit more in depth, because I think that's what people at home are thinking to themselves, well, I feel this way or I feel that way. What warning signs should they be telling others about that they need to call 911 for or seek medical attention for?
Yeah, so definitely any chest pain that comes on and lasts longer than a few minutes is a reason to call 911. That could be a heart attack. But it's important to recognize too that, in some patients, particularly in women and elderly patients, heart attacks can present differently. Often it's more shortness of breath, but certainly any chest pain that lasts more than a few minutes, severe shortness of breath, those are reasons to call 911. Another symptom that also warrants kind of immediate evaluation would be any passing out or losing consciousness, particularly if it happens suddenly without warning. That could be a sign of a dangerous heart rhythm and important to be evaluated.
Gotcha. And I think of when you say that, like with women, it presents something different. I think so often they'll just pass it off and just say, oh, I don't need to go to the doctor. Or if I go and it turns out to be nothing, then I'm going to feel, like I shouldn't have gone, but you would say you just go.
Absolutely. And we do see that. Sometimes people say, well, I had this episode of shortness of breath a week ago, and I thought, I'll just power through it. And it was a missed heart attack. So, for each patient, you kind of know your body. And if something doesn't feel right, it's important to be evaluated. But certainly, any chest pain or shortness of breath that's not going away, definitely better to be evaluated for sure.
All right, so for people who have survived a heart event, what steps should they take or keep on top of to help prevent yet another occurrence?
Yeah, so number one, I would say would be sure to follow up with your cardiologist and just make sure you make those follow-up appointments. Number two, I would say take your medications. Particularly, if you get a stent in your heart, you'll be started on a couple medicines to help keep that stent open. So it's critically important to take your medications as prescribed. And then the third thing I would say is kind of working on those risk factors to prevent another heart event. Taking your cholesterol medicine, diabetes medicine, getting that blood pressure down, working on those lifestyle changes that we talked about with diet and exercise. A great program after someone's had a heart attack is cardiac rehab, which is a supervised exercise program that's offered to patients to help them improve their exercise capacity after they've had a heart attack.
Okay, we have about just under a minute. What final piece of advice or action step would you like to leave with our viewers about having a healthy heart?
Yeah, I know we've talked about a lot of different lifestyle changes to make, and I know it can seem overwhelming at times to patients if you're thinking, well, I've got to quit smoking, start exercising, work on my diet, get my blood pressure down. And I always tell patients, just start small. May not be that you're going to start exercising 30 minutes a day, but just start going for a walk for 5 minutes today, and do that this week, and maybe in a couple weeks you increase that to 10 minutes, and you build up to that goal of 30 minutes of walking a day. So I would just encourage patients, start small, focus on one thing, stick with it, and you can achieve some really great results that'll have a lasting impact on your heart health.
All right, small changes to big changes. Thanks so much, Doctor. We appreciate your time. If you missed any of this, this is going to be in the To Your Wellbeing section of our website.